Welcome to Your Health with Dr. Stephanie. I'm Dr. Stephanie here at Uplift. Today we are discussing domestic violence. October is Domestic Violence Awareness Month, and the color purple symbolizes the bruising as a result of abuse. Every 15 seconds, a woman is abused in the United States, and 1 in 4 women will be abused in their lifetime. Educating the public on awareness, creating a movement that breaks the silence and cycle of abuse is paramount, now more than ever. I am joined today by Melody Keith, Executive Director of Serene Harbor Certified Domestic Violence Shelter, which is right here in Brevard. Welcome, Melody.
Thanks for having me.
Well, thank you for being here. So, okay, the purple ribbon symbolizing bruising. This is the color for domestic violence awareness. And not a lot of people know the purple is for domestic violence.
Right.
So we're changing that today.
Right.
And we're getting out there. I already talked to a bunch of people today because I've been wearing purple all October. All right, so first I want to start out, what is the definition of domestic violence? A lot of people don't understand it.
Well, domestic violence is just one partner controlling another, one family member controlling another. Basically, one person using power and control to keep their partner under control.
I feel like that a lot of people think that it's a family matter and that
Right.
people shouldn't talk about it.
Right.
And we know now that's not okay.
No, domestic violence is actually a crime.
Right.
It's a crime, and here in the state of Florida, thanks to our forethinking legislators in the Florida Coalition Against Domestic Violence, the penalties here are stiff for domestic violence,
Right.
and that's very, very important.
Now every day we're seeing on the news a new domestic violence incident where someone's murdered, and I know we have stiff penalties, but it's still happening.
Mm-hmm.
And what's your take on that?
Well, I think that one of the problems, again, is the awareness. Obviously, if there are stiff penalties and you go to a jury trial, let's say, we had the incident up at Parish Medical Center where Ms. Garvin was gunned down by her estranged boyfriend, and the jury's made up of people in the community who maybe know nothing about domestic violence and how serious and how lethal it can become. So it's difficult for them to wrap their head around what actually goes on in these homes. So it's important for us to make everybody aware in this community that domestic violence is a crime. It's no different than someone accosting me on the street and murdering me in some parking lot.
So because you think that there needs to be a better accountability,
Right.
that it's still happening.
Right.
So we need to make sure that people understand that and that it is a crime and it's not okay.
Right.
And I think that there's also the fear of getting out. Of course,
Right.
you had mentioned that 65% of the abuse happens after they've already left.
Right.
And so people need to understand that there are places where you can go. There are resources within the community, such as Serene Harbor and Salvation Army and the Florida Coalition Against Domestic Violence Hotline, to give information to people to help them leave and
Right.
getting an exit strategy. This center is more than just a shelter. Tell me about what else your center does.
Well, we not only provide the emergency shelter services, but we also operate a 24-hour hotline. So people can call in anonymously and get help from us without ever having to come through the door. People are often surprised to find that over the last 19 years, Serene Harbor has actually provided services to over 23,000 women and children right here in Brevard.
That is amazing.
That is amazing. When I say the number, it amazes me still.
Wow.
And a lot of those people call us and never come to the shelter.
Right.
We provide outreach services. They're in our prevention programs. They get our dating violence programs. And remember, there are 2 of us here in Brevard, 2 certified state shelters. So, you know.
And Salvation Army as well.
Right.
I really like that you do the primary prevention programs with the third graders. I don't know if you talk about that for.
Yeah, that's a lot of fun for us because it takes us out of the crisis intervention and moves us into the actually prevention and primary prevention. And we're hopefully making an impact on a long-term basis on some of these young kids.
Absolutely.
We actually go into 3rd grade classes that are identified for us through our community action team, which has some Brevard County school staff on it. And they identify schools for us who would let us come in and provide our 8-week curriculum about positive relationships.
Wonderful.
So we're not talking about domestic violence, we're talking about how to never go there.
Right.
So it's very exciting.
That's how I believe that you can eradicate the epidemic, is through
Exactly.
those primary prevention programs.
Exactly.
So that's wonderful, and we need to do more of them. Well, thank you very much for coming on the show, and I look forward to working with you in the future on many other endeavors.
All right, thank you.
For more information on this topic and more health news, check out Your Health with Dr. Stephanie, which runs every Thursday in Florida Today's Health section, or visit floridatoday.com.